Morning, class. This is our last lecture of Nursing 301 for this term, and we're going to cover Chapter 74, which is the child or adolescent with special needs. So let's get started so we can get through this lecture. Remember, this is your last lecture for Nursing 304. So special needs clients. Special needs. Special needs is a term used to describe the circumstances of some individuals who may need assistance due to intellectual, medical, and psychological disorders. They may have a combination of disorders that involves disabilities, ranging in severity from mild to severe and sometimes fatal. Each individual and disorder has unique properties and manifestations that differ according to age, gender, current level of disability, and environmental support systems. Family caregivers of a physically or mentally challenged child may go through a grieving process, and this may occur intermittently as a child reaches or fails to reach developmental milestones. But this grieving does not mean that the caregivers do not love the child. Your support and understanding can help caregivers cope. Disabilities and disorders. Some of these conditions may have genetic origins and others are acquired. Special needs and disabilities are usually interrelated, and they include the ability to learn new things, succeed at a specific pace, communicate with others, and socialize in a group, and have a continuum of health. Intellectual disability refers to a problem for an individual who has cognitive impairment demonstrated by below average ability to learn and to use knowledge. It can be genetic. It can be related to maternal complications. It could have occurred during fetal development or as a result of birth trauma. Intellectual abilities are given a numerical designation based on a standardized test. The average baseline normal score is 100. Borderline, the IQ is between 70 and 85. IQ tests are good predictors of academic achievement. However, they are criticized for not being able to indicate other types of intelligence. Intellectual functions or intelligence refers to general mental capacity, learning, reasoning, or problem solving. Adaptive behaviors are their responses to everyday needs. They include their social needs, day-to-day activities, and personal responsibilities. Developmental disability is a term that includes intellectual disability, but also involves physical disabilities. It is associated with individuals' failure to meet developmental milestones, often related to damage to the brain, resulting in chronic physical problems. Special learning disabilities, or SLDs, are disorders in which one or more parts of the CNS do not function normally. They may have difficulty reading, writing, developing or using social skills, and maintaining an emotional balance. They may have a lower than average IQ. They may also have visual or hearing impairment. They process their thoughts and ideas differently. Communication may be difficult, and they have a different learning style. So with a different learning style, we need to tailor their education to their needs. When we care for a client with special learning disabilities, we need to learn about the specific disabilities from parental caregivers and set achievable goals. We need to consider individual needs and limitations and set goals. We want to provide positive reinforcement, have patience, and give instructions in small steps, 1 or 2 at a time. We always want to provide positive reinforcement, have patience, and give instructions in small steps, 1 or 2 at a time. Also, we need to take into consideration their age, their sex, their developmental level, their family environment, any type of medical problems, and what their prognosis is. Our priority is meeting their basic needs. Some disorders may require special feeding techniques. Others have to have assistance in meeting the basic survival needs of the child. Special learning disabilities. We have visual impairment, genetic or congenital acquired cataracts. Genetic this is the most frequent cause. The cataracts could be related to their exposure to rubella in utero. Optic nerve atrophy can be caused by glaucoma or diseases of the brain and the CNS. Retrolental fibroplasia is related to O2 toxicity. Amblyopia is impaired or dim vision without obvious defect or change in the eye. Retinitis pigmentosa, retinal damage. Refractory errors causes blurred vision images. Strabismus is the eyes don't look in the same direction at the same time. And trauma could be related to shaken baby syndrome. Dyslexia is a most common disorder. They have difficulty with reading, spelling, or writing words because they reverse letters or numbers. As nurses, we can, if a child is visually impaired, we can provide clocks with large numbers, calendars with large letters and numbers, give them large print books to read. We want to encourage them to participate in activities with their peers, such as music and swimming. And also we can provide community resources and support group information. Hearing impairment can be related to fetal exposure to cytomegalovirus, herpes, rubella, or syphilis. Meningitis, chronic ear infections, Down syndrome, exposures to loud noises, and certain medications. Children who are hearing impaired will sometimes avoid social interaction. They'll play alone. They'll act timid. They may not learn how to talk. They'll have poor socialization skills, poor speech development. The major issues for the family is communication and safety. Nursing considerations would be speech therapy and sign language. Speech development. Be patient, talk slowly and clearly. Do not use baby talk. Encourage listening. Talk to them, read to them. Speech impairment. Hearing deficit is a common cause of speech disorders, muscular disorders, or cleft lip or palate. Some children may have a lisp. Some may have disfluency, which is an interruption in the natural flow of speaking, or stuttering. Stuttering is usually normal in some preschool children, but school-age children, it does require an evaluation. Nursing considerations that we want to take into consideration are speech therapy. Some children may need to have surgical intervention, orthodontics, referrals, and some children benefit hugely from the use of computers. Lifestyle. What community resources are available? What support groups are out there for the caregivers? Encourage participation in educational, social, and recreational activities. Activities of daily living. Use specific techniques to teach skills. Patience is the most important factor in working with the intellectually impaired child. Patience is the most important factor in working with the intellectually impaired child. And behavior modification. Use positive reinforcement. Their desired behavior may need to be repeated. numerous times before it becomes habitual. So remember, patience is the most important factor in working with the intellectually impaired child, and with behavior modification, use positive reinforcement. Teaching plan for the special needs client. There are teams and teams of professionals that are necessary to cover all the needs of the child, family, and the family unit. Social workers design community and financial resource plans for the family. You'll have behavioral therapists. They help with learning deficits and day-to-day emotional needs. There's also adaptive care devices such as hearing aids, glasses, vision-enhancing equipment, braces, and walkers that help with mobility and their ADLs, and educational services for the disabled individual. They may be homeschooled or, they may be placed in specialized classrooms. The etiology of disabilities and disorders. Genetic disorders are conditions that are passed from one generation to the next. They are hereditary, resulting from defective chromosomes or genes, inborn and present at birth, but may not be immediately apparent. Genetic counseling is the process of helping people understand and adapt to medical, psychological, and familial implications of genetic contributions to diseases. It integrates family and medical histories, education about genetic inheritance, and testing, management, prevention, resources, and research, and counseling to promote informed choices about risk and adaptations to the condition. Genetic counseling is available for people who are seeking information about the possibility of genetic disorders in their families. Genetic disorders that are also congenital disorders. Congenital disorders Congenital means it's present at birth. Sorry about that. A congenital disorder is one that exists at birth. It can be caused by a defective gene, which in some cases can be hereditary. If the congenital condition results from a mutation of the fertilized or embryonic cells, the condition is a genetic congenital disorder, but not an inherited genetic disorder. However, if that child passes on the defective gene, the next generation will have a congenital, genetic, and hereditary disorder. So remember that a congenital condition that results from the mutation of the fertilized or embryonic cells, the condition is a genetic congenital disorder, but not an inherited genetic disorder. Here are a list of genetic disorders: neurofibromatosis, Tay-Sachs disease, Down syndrome, Fragile X syndrome, cystic fibrosis, Duchenne muscular dystrophy, hemophilia, sickle cell disease, and phenylketonuria. The three that I really want you to remember are the neurofibromatosis, Tay-Sachs disease, and Down syndrome. The three genetic disorders that I want you to remember are neurofibromatosis, Tay-Sachs disease, and Down syndrome. Acquired disorders are fetal alcohol spectrum disorders, fetal alcohol syndrome, alcohol-related neurodevelopmental disorder, alcohol-related birth defects, neonatal abstinence syndrome, exposure to maternal infections, and typically early treatment promotes maximal progress. Common disorders, colored blindness. Colored blindness is decreased or lack of ability to see certain colors. It is typically inherited. It does not imply a vision loss or total blindness. The most common is reds and greens. Less common is blues and yellows. And then there's monochromacy, which they see blacks, whites, and grays. Treatment, there is no treatment. But if it's acquired, we can eliminate causative factor. By eliminating the causative factor, it may restore their color vision. Some children might be labeled as having a reading disorder if the material they're reading is color-coded. Some other daily activities might be disrupted, such as with a stoplight or dressing, matching clothing. Hemochromatosis. Hemochromatosis is either hereditary or acquired, and that's where the body absorbs iron from foods and stores excess iron in body tissues and organs. It can cause cirrhosis. It can cause liver cancer, diabetes, heart failure, erectile dysfunction, joint pain, or skin color changes. It is typical in men 50 to 60 years old and juveniles teenage years to about 30. Treatment is to reduce the amount of iron in the body. Most common method is removal of blood on a regularly scheduled phlebotomy session, and they take off about 1 unit or a pint at a time. Nursing considerations. You want to teach the client to avoid iron supplements, multivitamins containing iron and vitamin C, and avoid eating raw shellfish and avoid alcohol, because vitamin C, if taken with foods such as orange juice, increases iron absorption. And tannin-rich teas slow storage of iron. Neurofibromatosis. It is genetically inherited. It is a benign, they're benign, painful tumors that develop as a growth on nerve tissue. It is a strong indicator of neurofibromatosis is cafe au lait spots. There are 3 types. There's type 1, which is NF1, type 2, which is NF2, and schwannomas. But remember, the strong indicator of NF type 1 is the cafe au lait spots, which are harmless light brown spots on the skin. The NF2 neurofibromas grow on the 8th cranial nerves. And with schwannomas, they grow on spinal, cranial, and peripheral nerves. Treatment is palliative, provide pain relief. They may do surgical removal of problematic lesions and physical therapy. So our nursing considerations is provide pain relief, physical therapy, and we want to be alert for any neurological signs and symptoms for cognitive impairment or learning. Polycystic kidney disease. Is it inherited disorder? It is a cluster of cysts that develop within the kidneys. Liver and other areas can be affected. They're non-cancerous round sacs filled with fluid. Complications develop as the cysts put pressure on functional areas. Hypertension and headaches are common. They may be precursors to kidney failure. Other signs and symptoms include chronic back pain, abdominal distension, urinary frequency, hematuria, UTIs, and kidney infections. We want to control hypertension to prevent kidney function. They may be given ACE inhibitors. They may also do surgical interventions to remove problematic cysts. And we want to educate the clients regarding a low-salt diet, their fluid intake, their dietary intake of fruit, vegetables, and whole grain. We want to educate them to maintain a healthy weight, their medications they're taking. We want to monitor their blood pressure and encourage them to exercise. Tay-Sachs disease is a fatal inherited metabolic disorder. That's where certain lipids accumulate in the body due to the absence of a fundamental enzyme, which results in progressive destructions of the neurons within the nervous system. It causes damage to eyes, ears, movement, and mental development. Motor development gradually regresses until the child can no longer crawl, turn over, or sit. How they diagnose it is the child is not progressing in growth and development. By the age 3 to 4, they become severely cognitively disabled, blind and paralyzed, and unresponsive. Their nervous system, around age 5, their nervous system no longer functions, which can lead to death. Ashkenazic Jewish are at risk. And treatment, it's palliative. We want to provide support to the parents because there is no cure. We want to provide information to the parents regarding genetic counseling. They can also do prenatal testing via chorionic villus sampling between the 10th and 12th week of pregnancy, or they can do an amniocentesis between the 15th and 18th week of pregnancy. Prader-Willi syndrome is a complex genetic disorder. Most cases are not inherited. There is no family history. It is considered a multi-phase syndrome because signs and symptoms develop in stages. They will have hypotonia, which is poor muscle tone, hyperphagia, chronic feelings of hunger. Weight gain is noted. Their metabolism is slow. They have an insatiable hunger that leads to excessive eating. They'll have life-threatening obesity, diabetes type 2. They have a short stature with small hands and feet, fair skin, and distinctive facial features. They'll have a narrow forehead, almond-shaped eyes, and a triangular mouth. Nursing considerations, we want to provide education regarding diet, exercise, and behavioral therapy. Excuse me, and provide community resources. Fetal alcohol spectrum disorder and fetal alcohol syndrome. It is a term describing a wide range of physical, mental, behavioral, and learning disabilities. Fetal alcohol syndrome, FAS, is the most severe form. Leading known preventable source of mental retardation and birth defects. And it also causes intellectual development. So with fetal alcohol syndrome, or FAS, it is the leading known preventable source of mental retardation and birth defects. Detrimental effects of alcohol are permanent but are preventable. Signs and symptoms is growth retardation. Signs and symptoms is growth retardation. Excuse me. They'll have developmental delays, below normal mental functioning, and dysfunctions of the CNS. They'll typically have abnormal facial features. They'll have small, wide-set, narrow eyes, drooping upper lids, short, upturned nose, flattened cheeks, and a small jaw. Treatment is early recognition and referral to support services, counseling, and support services. Nursing education, we want to provide education regarding dangers of consuming alcohol. During pregnancy, we want to encourage support groups and discuss lifetime consequences. Neonatal abstinence syndrome, or NAS, is a group of medical problems in a newborn who is exposed to addictive opiates or narcotic drugs as a fetus. It can include heroin, codeine, oxycodone, methadone, etc., etc. Signs and symptoms, you will see anxiety, insomnia, diaphoresis, vomiting, muscle pain, and goosebumps. It can last 1 week to 6 months, depending on the severity of exposure. They're at greater risk for infection, neonatal respiratory problems, and death. They can have tremors, hyperactive reflexes, high-pitched cry, irritability, seizures, and excessive crying. They're skin mottled. They don't feed well. They can also have tachypnea. They may have difficulty sleeping. And they may show signs of failure to thrive, which can start in the first 3 days to 1 week, depending on when mom last used. So the treatment, it depends on the severity of the symptoms, the type of the drug mom used, and the overall health of an infant. But remember, what we have to remember too is abrupt discontinuation of the drug causes withdrawal in the newborn. So nursing considerations, we need to do postnatal checkups in the home, education regarding nutritional support. We need to provide supportive care of the infant when they're in the healthcare facility, and we want to be gentle, but they have minimal handling and rocking. We also want to monitor their vital signs, their sleeping habits, their feeding patterns. We want to prevent neurologic stress, and to do that, we need to minimize lights, noise, and handling. We need to decrease that environmental stimulation, and we can offer a pacifier and swaddle them. Excuse me. Down syndrome is a genetic disorder caused from abnormal cell division of chromosome 21. The degree of the disorder may vary in severity. It can cause multi-system disorders, congenital cardiac defects. Children with Down syndrome have an increased incidence of leukemia, severe respiratory illnesses, thyroid disorders, megacolon, and hypotonic abdominal muscles. They will have developmental delays in social, sexual, and physical areas. In advancing maternal ages increases the chance of giving birth to a Down syndrome baby as mom's eggs are older. Treatment for Down syndrome is symptomatic. We want to, as nurses, focus on the prevention of complications. We want to provide education and support for the family. Respite care is recommended. And we want to provide social services, healthcare, and financial resources to the families. Fragile X syndrome is a genetic sex-linked abnormality, the X chromosome. A specific protein is absent. About half of children with Fragile X syndrome have autism. Women are carriers, but men can also be carriers. This condition often manifests more in boys than in girls, and the child will benefit from speech and occupational therapy. There is no cure for Fragile X. Early interventions is necessary to maximize the child's potential education. Their signs and symptoms of Fragile X falls into 5 categories: intelligence and learning deficits, physical characteristics, social and emotional problems, speech and language difficulties, and sensory problems. So the characteristics of Down syndrome and Fragile X. Down syndrome, they have a round, small, short head. Fragile X, it's abnormally large. With Down syndrome, their face is flattened. They will have small, low-set ears. Where Fragile X, they will have large, protruding ears. Down syndrome, their nose, they have a depressed nasal bridge. Fragile X, it's a flattened nasal bridge. Their hands, they both have the simian creases. Fragile X and Down syndrome both have simian creases. Their mouth with a Down syndrome child is high arched palate, protruding tongue, and mouth curved downward. Behavioral, with Down syndrome, intellectually impairment and language delay. With Fragile X, intellectual impairment, autistic-like behaviors, and speech delays. Attention deficit hyperactivity disorder. There's 3 categories: inattentiveness, impulsivity, and hyperactivity. It begins in childhood and may continue throughout adulthood. How they diagnose it is symptoms must be severe, occur for at least 6 months, and significantly affect the child's developmental milestones. Inattentiveness, they're easily distracted, daydreams, and they seem forgetful. Hyperactivity, they talk nonstop, fidget, constant movement. Impulsivity, they interrupts, emotionally inappropriate, they're impatient, and make inappropriate comments. To treat attention deficit disorders, it's a multifaceted approach that involves the caregiver and the child. Early intervention is essential, and psychological counseling and medication therapy may be beneficial. Nursing considerations. If a child is taking Ritalin, you want to measure their height and weight at frequent intervals and plot on a growth chart. Failure to gain in either area, you need to report it. You want to provide support groups. You want to teach the families to minimize stimuli, use consistent discipline, set limits, focus on positive behaviors, give directions one step at a time, and follow routines. With Tourette syndrome. Tourette syndrome is an inherited neurological disorder of unknown cause characterized by repetitive, multiple involuntary movements and uncontrollable vocalizations called tics. Signs and symptoms vary in frequency, severity, and location. It's usually first noticed in childhood. They will have motor tics and vocal tics. They may say inappropriate words or repetition of words or phrases of others. Some individuals may need neuroleptic drugs, but nursing considerations, we need to focus on their education. We need to be compassionate, be tolerant, and have patience. Autism spectrum disorder. It is a lifelong complex developmental disorder characterized by intellectual, social, and communication deficits. It is possibly genetic and environmental. More boys than girls are usually diagnosed with autism. They can show signs in early infancies, and their abilities range from low to high functioning. Signs and symptoms that may develop suddenly without warning. They may lose previously acquired language skills. They lack communication and avoid eye contact. They may become very upset, aggressive. They may have repetitive movements, and they resist change. There is no known cure for autism. Treatment for autism is individualized, and these children need a highly structured educational environment. They like routines. Most autistic children love routines, and medications is based on a case-by-case basis. But nursing considerations, we need to emphasize on the positive and focus on the child's skills. We need to teach the caregivers to give immediate feedback. Talk to them in short sentences, give simple commands. There is a concern regarding safety. And like I said, you want to maintain those daily routines, and respite services can be helpful for the caregivers. Plumbism. Plumbism is another word for lead poisoning. It can be toxic to both adults and children, but it's especially dangerous to children. It can be acute or chronic. It can be caused by ingestion of leaded paint chips, water that passes through old pipes that contain lead. Signs and symptoms may not appear until large quantities have accumulated in the organs and tissues. Children develop anemia. They develop severe stomach aches. They may have hearing loss, muscle weakness, and they may suffer from brain damage, which is permanent. We need to remove the lead sources and treat symptomatically. If they develop anemia, we need to provide iron supplements. Seizures, we need to provide anti-seizure medications. For nurses, we need to be alert for changes in play activity, such as new aches. They may have new aches or pains. We need to provide education to the caregivers regarding children's toys. There may be lead in the toys depending on where they were manufactured. Avoid areas where lead might have contaminated the soil. Wash hands before eating. And avoid tap water when cooking or preparing formula if old lead pipes are of a concern. Cerebral palsy. It's a general term used to describe movement and coordination disorders in children that are a result of some form of brain damage. Etiology, it can be a brain injury during fetal development, is the most common cause. Congenital, it could be a result of infections during pregnancy, brain injury during the birth process, after birth. It could be acquired as a result of kernicterus, which is excessive bilirubin, and jaundice, bacterial meningitis, viral encephalitis, head injuries related to falls, can be related to child abuse or motor vehicle accidents. Signs and symptoms. They can have spasticity, rigidity, ataxia, tremors, contractures. Spastic cerebral palsy is the most common type. It is sudden involuntary contractions of muscle groups. Muscles are stiff. And spastic cerebral palsy can be subclassified according to what parts of the body are affected. Dyskinetic or athetoid cerebral palsy is slow, writhing, involuntary movements or rapid, jerky movements. Ataxia cerebral palsy causes problems with balance and coordination. And mixed cerebral palsy is most commonly a mixture of spasticity and dyskinetic movements. Muscular dystrophy is there is a group of 30 genetic diseases, causes muscle wasting with a gradual loss of strength and increasing muscle deformities. It's related to a deficit or lack of the protein dystrophin in the muscles. It can be inherited or can occur in a family with no previous medical history. So it is related to a deficit or the lack of the protein dystrophin. It usually appears around age 3. They may have noticeable developmental delays, may not be able to walk upstairs, run, or get up off the floor. They will have a positive Gowers sign. That's where the child uses the upper extremity muscles to compensate for weak hip muscles. A positive Gowers sign, you'll want to remember what that is. A positive Gowers sign is the child uses the upper extremity muscles to compensate for weak hip muscles. Treatment, there is no treatment, but supportive treatment, wheelchairs, feeding tubes, ventilators. The goal of though is to maintain physical function for as long as possible and to prevent complications such as pneumonia, UTIs, dehydration, and injuries from falls. Duchenne muscular dystrophy is the most common degenerative muscular disorder. Its progressive atrophy is symmetrical groups of skeletal muscles. The lack of dystrophin in the muscles results in progressive muscle wasting with gradual loss of strength and increasing muscle deformities. And the positive Gowers sign. I explained that previously. The positive Gowers sign is where they they compensate for their weak hip muscles and use their upper extremity muscles. Mental health versus mental illness. The CDC states that mental health in childhood means reaching developmental and emotional milestones, learning healthy social skills, and using coping skills when problems occur. Mental illness are alterations in thinking, mood behavior, communication, or a combination of these. It is often a consequence of inadequately treated physical disorder resulting in poorly developed coping mechanisms. Mental illness in the younger person are often diagnosed with one or more of the following issues: depression or affective mood disorders. It is seen in individuals who have persistent feelings of sadness. Schizophrenia is a serious psychological condition involving distorted ideas of reality and thoughts. Anxiety disorders are very common. Situations become overwhelming and change is difficult. Eating disorders, they may displays of psychological issues. They can, as I said, eating disorders, they can suffer from anorexia, bulimia, and binge eating. And intellectual and developmental disabilities can be linked to a variety of disruptive behaviors such as ADHD or autism. Childhood depression. And we just talked about those. I went through that. For the signs and symptoms, you know, we have to remember serious depression interferes with daily life. And depression is a risk factor that is almost most often identified with suicide. Signs and symptoms. The one thing we're going to see is changes in their behavior. And sometimes signs and symptoms of depression are often subtle, and not all symptoms occur in all individuals. Treatment is first step. We have to identify the symptoms. Psychotherapy and counseling, they may require hospitalizations, and medications vary. And we have to have the cooperation of caregivers. Client teaching must be done patiently and in phases because they need to learn new concepts of how they have to learn new concepts. And learning those new concepts can become overwhelming to the stressed mind. And so we need to also include in that, we have to discuss the necessity of medications daily and monitoring for side effects, especially suicidal ideation. Suicide. Women attempt suicide more impulsively with poisons or drugs. Men are usually more successful, and they most generally use more lethal methods such as guns and hangings. Suicide is often a response to a stressful situation or an accumulation of stressful situations. Suicidal ideation and gestures are symbolic cries for help. The key warning signs that must not be ignored. Suicidal ideation and gestures are symbolic cries for help, which are key warning signs that must not be ignored. And another one warning sign that is easily missed is a suicidal person becomes suddenly cheerful, which may indicate the individual has decided to commit suicide and is relieved about the decision. Treatment, counseling, counseling, medications, but you got to find that treatment that is the best fit. They may need hospitalization, but as nurses, we need to be aware of early signs of depression. Listening is more effective than talking to individuals. Consider using a no suicide contract. Consider using a no suicide contract. And that is where the person agrees not to attempt suicide for a specified period and will contact help immediately if they feel suicidal. A no suicide contract can be effective in some situations. So remember, key warning signals: depression, morbid discussion of and preoccupation with death, and then they have a sudden cheerfulness followed by somber, withdrawn, depressed period. And that is an early warning sign that is easily missed. Risk factors for suicide: previous attempts or local epidemics of suicide, family history of suicide and child maltreatment, history of mental disorders or alcohol and substance abuse, feelings of hopelessness, loss, impulsiveness, or aggressiveness, maybe isolation, access to lethal methods, barriers to assessing mental health treatment, physical illness, especially chronic illnesses, and cultural and religious beliefs. So the ones I want you to remember: a family history of suicide, impulsiveness or aggressiveness, access to lethal methods, and medical illnesses with chronic medical illnesses, especially if they have a chronic medical illness. So it's family history of suicide, impulsiveness or aggressiveness, access to lethal methods, and chronic medical illnesses. Schizophrenia is a serious psychological condition involving distorted ideas of reality and thoughts. Usually, schizophrenia is a lifelong disorder but may be managed. If developed before adolescence, there's a less success overall in life. Usual onset is late teens, early 20s. Causes are not totally clear but appear to include genetics and environmental. Schizophrenics are at high risk of suicide. Signs and symptoms is impaired ability to function, paranoia, aggression, delusions, hallucinations. They may have auditory hallucinations, have negativity, abnormal, disorganized behaviors. They'll have word salad, flat or inappropriate affect. They're out of touch with reality. Treatment is you need a team of specialists. They may need to be hospitalized and be placed on antipsychotic medications. Behavioral modification, psychotherapy, and family therapy are all very pertinent. So for nurses, we have to educate ourselves on what is schizophrenia. We need to ensure and provide supportive counseling to family and caregivers. And how do we know medications are effective for individuals who take medications for schizophrenia? Is usually when the symptoms diminish or disappear. But common symptoms, difficult to differentiate between schizophrenia and the typical teenage behaviors, is withdrawal, changes in school performance and activities, mood changes, and trouble sleeping. And that sometimes those are common symptoms that it's difficult to differentiate between schizophrenia or typical teenage behaviors. That is the end of chapter 74. Also, on the weekly outline for week 10, I am also going to post a video that I would like you all to watch. And that video is also includes, it's also included for this chapter, and the video is on child abuse and reporting. And the we have to remember we are mandatory reporters. So I will provide the video link on week 10's outline for that. I want you guys to have a great week. And this is, like I said at the beginning, this is the last chapter for Nursing 301. Have a great week.